Hi, welcome to ABMBPS. Today's topic is health planning and management. This video is based on the health planning chapter from the Park textbook of community medicine. In the first part of the video, I will be talking about health planning, and in the second part, I will briefly discuss the important health committees given in the textbook. So, first tell me the difference between objective, target, and goal. Objective is the planned endpoint of all activities. It is either achieved or not achieved. It is precise. Target is a discrete activity which gives us an idea about the degree of achievement. Targets are concerned with the factors involved in the problem, whereas objective is concerned directly with the problem in itself. For example, when I say I will publish 100 videos by December 2017, it is a target because it is concerned with the factors involved with the problem. But when I say I will achieve 1000 subscribers by December 2017, it is an objective because it is concerned with the problem in itself. Finally, a goal is the ultimate desired state towards which all our efforts are directed. It is not bound by time or resources. It is our ultimate destination. Next, we come to plan. A plan is a blueprint for taking action. It prevents wastage of resources and helps develop the best course of action. Next, we come to the topic of planning cycle. It tells us the sequence of steps needed to be taken whenever we are faced with any health situation in a community. At first, we have to analyze the health situation. Next, we need to establish the goals and objectives. Then, we need to assess the resources and fix priorities. Next, we need to write up an effective plan and skillfully implement it. Finally, we need to monitor our plan carefully and evaluate it from time to time. Next, we come to an important question which is often asked in the exams. What is the difference between cost-benefit analysis and cost-effective analysis? In cost-benefit analysis, benefits are analyzed based on monetary terms. Example, Plan A costs Rs1000 whereas Plan B costs Rs1500. So Plan A is better because it is cheaper. Whereas in cost-effective analysis, benefits are analyzed based on terms of results achieved. Example, number of lives saved or number of disease-free days. Example, Plan A saves 100 lives whereas Plan B saves 50 lives. So Plan A is better because it saves more lives. This brings us to the end of the first part of the video. Now coming to the different health committees. The first committee that you should be knowing about is the Bohr Committee. It was also known as the Health Survey and Development Committee. It propagated the idea of social physicians. These people were given a short 3 months training in preventive and social medicine, and they would be allowed to treat minor illnesses in the society. It proposed two plans, a short-term plan and a long-term plan. According to the short-term plan, there would be one PHC per 40,000 patients and it would be 30 bedded, while according to the long-term plan, there would be one PHC per 10 to 20,000 patients and it would be 75 bedded. This was what was later known as the 3 million plan. Next came the Mudaliar Committee, which was also known as the Health Survey and Planning Committee. Now, if you notice, planning starts with P and Mudaliar starts with M, so we get a bit of a mnemonic here. Also, don't confuse it with the Bohr Committee because that was Health Survey and Development Committee. The Mudaliar Committee gave the concept of All India Health Service. Next, there was the Chada Committee, which proposed the idea of basic health worker. The Kartar Singh Committee, which gave the idea of male or female health worker. There was the Jangalwala Committee, which was also called Committee on Integration of Health Sciences. Now, if you notice carefully, I and J look remarkably similar. So there's another mnemonic for you. And in case you are wondering why such a weird name, Junglewala, then remember it's because the committee proposed the idea of banning private practice. Finally, we come to the Srinivastava committee. Everything about this committee was about health education. It was also called the Group on Medical Education and Support Manpower. It proposed the reorientation of medical education scheme or the ROME scheme. You notice the underlying theme here? It's all about medical education. The committee also gave the village health guide scheme and gave the concept of three-tier village infrastructure. This brings us to the end of this video. You can also watch the other videos on this channel. The link is available right here. Guys, thank you for watching this video. Please do not forget to like, share and subscribe if you like our work. Also, you can suggest us topics to do videos on by commenting on the section below. Bye bye and happy learning.